Okay, and welcome to the University of Lethbridge. Our university's Blackfoot name is Iniski, meaning sacred buffalo stone. We're located in traditional Blackfoot Confederacy territory, and we honor the Blackfoot people and their traditional ways of knowing and caring for this land, as well as all Indigenous peoples who have helped shape and continue to strengthen our university community. The Prentice Institute for Global Population and Economy has a mandate to examine big picture issues related to global population changes within a broad historical framework, while also connecting local and regional changes with similar global trends. The Institute contributes to the development of evidence-based policy options to guide Canadians and their governments in addressing some of the difficult challenges facing the world. We are very pleased to be joined today by Dr. Bonnie Lee, Professor in Health Sciences at the University of Lethbridge and Research Affiliate of the Prentice Institute, and Dr. Chance Bell, Assistant Professor in the Counseling, School Psychology and Family Science Department at the University of Nebraska at Kearney in the US. Dr. Lee holds a PhD in Religious Studies from the University of Ottawa and is a registered marriage and family therapy supervisor and a registered social worker. She is also the founder and advisory chair of the Graduate Certificate Program in Couple and Family Counseling Studies in the Faculty of Health Sciences at the University of Lethbridge. Her research expertise is in the areas of addiction, couple and family therapy, spirituality and religion in counseling and health, health promotion, and global mental health. Dr. Bell holds a PhD in marriage and family therapy from Florida State University in the US. His expertise is in the areas of couple relational and mental health and the use of dyadic data analysis methods, with a recent emphasis on couple relationship protective factors that include character strengths and virtues such as humility and forgiveness. Both have numerous publications in these topics. In their talk today, entitled Mental Health Practitioners' Preparedness to Engage in Relationship and Religious Spiritual Issues in Counseling During the COVID-19 Pandemic, a latent profile analysis, they will address mental health practitioners' engagement with the issue of relationships and religious spiritual concerns underlying mental health during the COVID pandemic, and will explore implications for counseling training and education. They will speak for 35 to 45 minutes, followed by 15 to 25 minutes for questions. This talk is being recorded from the Prentice Institute archives. Please join me in giving a warm welcome to Dr. Lee.
Bonnie, if you stand right here, the camera will see it's in the top left, and then Andrea, if you can change the view to speaker view.
Yes.
Okay, you have to back.
Just play it like this.
Good afternoon, everyone. Thank you for joining us this lunch hour for this webinar. And I'm usually given 20 minutes for conference presentations, but now we have an hour. That's a candlelight version. So, yes. So I look forward to having your questions and answers, afterwards. So the title of our talk is Mental Health Practitioners' Preparedness to Engage in Relationship and Religious Spiritual Issues in Counseling During COVID-19 Pandemic. So we wish to thank the Prentice Institute Research Affiliate Fellowship Grant in funding this study. In addition to Dr. Chance Bell, hi Chance, there you are, who is a co-investigator in this study and who will be co-presenting with me today. We have also Dr. Samuel Fori-Day, who was a postdoctoral fellow at the Prentice Institute during the conducting of this study. And also we want to acknowledge our research assistants who helped with the launching of the survey, literature review, and some of the data collection. So the objective of this study is to examine mental health practitioners' preparedness to include relationship and religious spirituality issues during the COVID-19 pandemic in their counseling. So what prompted this study? This study was conceptualized in 2020 at the early stage of the pandemic. And problems were already surfacing in terms of mental distress, alcohol and substance use, and an upsurge of domestic violence. So there was one paper that came out very early that was a call for action for mental health counseling, but it was primarily focused on individuals in the area of studying brain function, cognition, depression, anxiety, self-harm, and suicide. Research priorities in that paper also targeted the individual, including looking at coping, risk of abuse, consumption of media, exercise, art space, activities, and life skills. So what was missing was looking at relationship and religion and spirituality issues in that article that was proposing what we needed to focus on in terms of research and practice to help with the pandemic. So I did a search of the literature at the time, and I found that religion and spirituality, as well as relationship issues, play important roles in coping and resilience in trauma, crises, and disasters in previous studies, such as the Hurricane Katrina, tsunamis, and the Oklahoma bombing. So, there were studies in previous disasters, studies and crises that highlighted the importance of religion and spirituality as well as relationship and bolstering resilience. And anxiety and distress are likely to result from prolonged and forced social isolation and diminished social contact. And that came out, in other types of disaster studies. Increased proximity and frequency of interactions in families can magnify communication problems and existing dysfunctional patterns. And, even at the early stage, there was research finding communication could increase adaptivity, problem solving, instrumental and emotional coping, and mutual support. Earlier studies found traumatic events could elevate stress levels and lead to high reactivity and emotion dysregulation among family members, creating even more stress, especially among those with pre-existing addiction and mental health conditions. So when we did a more recent literature review, we found that, and as you all know, the impact of the pandemic had physical, mental, financial repercussions, and also relational and spiritual impact. And we should look at these factors not as isolated factors, but they're all intertwined and they affect one another. So in terms of relationship impacts, and here, so as not to clutter up my slides, I didn't show all the references, but if you're interested in the references, we have a paper that has been submitted to the Journal of Marriage and Family Therapy that is under review after revision. So that should be out soon, and we'll be happy to share that with you. So this is all based on our more recent literature review. Relationship impacts include affecting family communication and adaptation, elevated relationship stress and conflicts during pandemic, parent-child dynamic. So we looked at that as a separate issue, especially between adult parent and child. So intergenerational relationship issues and work relationship issues that surfaced during the pandemic. The literature review also showed existential crises being a big issue with the pandemic. And the health sciences literature especially highlighted that, in hospital settings. But in terms of counseling, it was found in community studies, religion, spirituality, and moral concerns were highlighted because people were looking for meaning, purpose, and belonging. And they also had to deal with end-of-life decisions, loss and grief, and not being able to attend funerals and rites of passage of their loved ones, not being allowed to visit them, when they were ill. So it created moral distress among family members as well as health practitioners who had to enforce these regulations. So grief and loneliness, and there was a lack of connectedness. So religion and spirituality could offer some of these supportive measures, in terms of creating connectedness, peace, and transcendence. And also people were not allowed to attend church services. So that was also another impact of the pandemic that was detrimental. So religion and spirituality is not a very well-trained area among counselors and healthcare professionals. Usually that's an area that is not touched just because it's really hard to teach religion and spirituality in a diverse setting. And people are afraid of controversy, and maybe being attacked for their beliefs. It's such a personal and sensitive area. So it's not often taught in the curriculum. And I'll talk a little bit about that in the discussion. So it is an integral part of people's lives that is often intertwined with their culture as well in terms of their practices. Whether it's attending synagogue or mosque or churches. It provides social and spiritual support, and people seek trusted guidance from the elders, in these religious communities. And religion and spirituality are could be distinct from each other in that religion usually has an institutional meaning involving communities. And spirituality could be found within religion, but also apart from religion in terms of personal practices or connection with nature or one's spiritual practices like meditation. So what kind of couple conflicts were featured in the literature? And more literature on these relational issues is coming out even now, as people start finishing their analysis of their research during the pandemic. So what kind of couple conflicts? Financial loss and unemployment could create stress. And when we have elevated stress, people are more short-fused, and there could be more conflict and arguments. There's the blurring of work-home boundaries during the pandemic, because of working from home. And so it's hard to differentiate the two. And then, space could be a problem too. Homeschooling was required in many cases, so it adds to the stress and the workload of the parents. And there were disruptions to routines, a loss of stabilizing rituals, because having structure, routine reduces stress because we know what to expect from one moment to the next in terms of family life. During the pandemic, there was also reduced access to extended family members and friends, and of course, schools, daycares, all that were really compromised. So disruption to access to extended family members and friends and support system. Children didn't play with their peers. Lockdowns and constant proximity to each other were enforced. So there was increase in domestic violence with less access to friends and social support, even though there was less report of child maltreatment, just because children did not have access to other people like teachers and other caring adults outside of the family. It was found that there was an increase in infidelity, which is interesting. Somebody asked, how could that be, when you have social isolation and quarantine? But, maybe it could be online. And couple conflicts are very much related to individual and mental health problems. Now, I should add here, there were studies that found some couple relationships and family relationships actually improved during the pandemic. Now, we don't know what percentage of them improved, but let's say if the family, was relatively well functioning, had some good communication skills, the pandemic kind of brought them closer because they had more time to communicate with each other, to renew their relationship, to solve problems together, which kind of brought more cohesion. But in other cases, especially if there were pre-existing relationship problems and mental health problems, those relationships tend to deteriorate. Parent-child problems during the pandemic. So increased risk of child maltreatment and abuse compared to pre-pandemic levels. And it was influenced by economic insecurity of the parents, unemployment, parental mental health issues. So, we can't just look at child mental health without looking at parental mental health and parental relationship because they form a system. Parental mental distress, anxiety, and depression predict children's stress and negativity. Again, there was loss of external social support. Increase in family conflict predicts subsequent child maltreatment. And parents were found to be more authoritarian during disasters. They use a more authoritarian style of parenting, maybe just to keep kids under control or to handle their own stress. Just to add to the parent-child problems, the literature did find that parents with anxiety, depression, or pre-existing mental health problems had more of an impact on child maltreatment and child misbehavior, child maladjustment. So it's all interrelated, parental health, individual health, and parent-child relationship. Intergenerational conflict. And here we did some literature research on intergenerational conflict. And indeed, the literature spoke about intergenerational conflict between adult parents and adult children because they had different views of the risk of the pandemic, socially and health-wise. So they had subscribed to different protocols, whether to wear masks and social distancing. And the pandemic also led to political differences in terms of following government protocols, and there were differences between generations. So intergenerational conflict certainly was reported in the literature, but also anecdotally in clinical practice. So I have a small clinical practice, and in that practice I have seen quite a few parent-child conflict that needed resolution because the parents, one of them subscribed to conspiracy theory, and it really upset the daughter, and so they had that big difference. And then in another case, the mother lost her job because she did not believe in vaccination, and then the daughter believed in vaccination, and the mother wanted to confide in the daughter about her stress, and the daughter was already stressed out, so she didn't want to listen to the mother anymore. So they didn't see each other for a year. And when they came to me, they wanted to be reconciled and see if there was a way they could compartmentalize their conversation so as not to accentuate their differences. And maybe just to talk a little bit about the relationship between individual anxiety and how the family plays a role in it. So I had a client who was a school teacher, and she was quite a perfectionist and very conscientious, but because of the changing protocols, with the school system and changing from online teaching, to in-person, she was totally stressed out because you have to design your lessons a little differently. So when she was referred to me by her family doctor, she was wondering if she has PTSD, and maybe that's the reason why her anxiety is quite heightened. So rather than working with her as somebody with a diagnosis, I checked out about her family situation, and actually it wasn't bad. She has a good relationship with her husband. Her son is doing quite well. So I asked her to maybe share a joy with her family, with her son and husband over dinner, instead of trying to get her to do something individually. And that actually worked wonders, even just with one session with that suggestion, because it took her mind off work and it gave her it restored more of a work-life balance. And she was less anxious, because in sharing her joy, people bring up happy thoughts, the good things that happen, which kind of shifted her attention to what's positive in her life. So I only saw this person maybe 2 or 3 times, and she was fine, she was great, and she developed better relationship with her family as a result. And was not so preoccupied and affected by the work stress. So workplace relational stress. Workplace changes in protocols and guidelines were constant during the pandemic. And people suffered from threat of infection for themselves and for their clients. There was a climate of uncertainty that fueled anxiety and hostility in the workplace, because people were stressed out, especially in the healthcare system. So as an example, I did see a nurse who did not want to get vaccinated because she has a very sensitive biological system that she thought would respond poorly to the vaccine. But then at one point, you're not allowed to work, you're suspended from work, if you have that issue. So, she just talked about it, and I didn't take sides, but I learned from her why some people would opt for not taking the vaccine. So she really appreciated being able to voice that, because it was something that ostracized her if she talked that way at work. So the workplace relational stress was really real. I had people working for airlines, who came in because they had to be always happy and nice to deal with irate customers who wanted their money back for the flights. Right, exactly. So these helpline people, they got the brunt of it. So he needed some help with that. So there were workplace relational stress that could create moral distress and mental issues. Increased workload, layoffs, restructuring of services, during the pandemic, and managers were also stressed out too, because they had to restructure the employees or have layoffs, and they had to be responsible for that. And I saw a few of those managers as well. So it affected every sector, education, healthcare, service sectors during the pandemic, and workplace relationship issues were really paramount. So research questions. We asked the question, what is the degree of mental health practitioners' engagement with relationship issues and religion and spirituality issues during the COVID-19 pandemic? And we did this study at the height, I would say, of the pandemic and the lockdowns between April and July 2021. And we wanted to know what demographic characteristics differentiate the degree of practitioners' engagement with these two areas, and what practitioners' attributes that best predict their engagement with religion and spirituality issues. And we did it in 2 provinces of the survey, online survey, in Alberta and Ontario, because they're quite different provinces in terms of provincial education and also healthcare. And also one is a much larger province in terms of population, Ontario, compared to Alberta. And they had different educational institutions, that would train counselors. So a survey took only 5 to 10 minutes and was mounted on Qualtrics. And we deleted surveys that were less than 30% completed. And we retained 92% of the surveys, and we had a sample size of 155 for the 3 months. So the survey looked at how mental health practitioners appraised the contribution of religion and spirituality issues and relationship issues to the presenting problem. And whether they included questions of relationship and religion in the intake assessment in the past 30 days, and the confidence in doing so, and then whether they felt that they wanted to enhance their skills in these 2 areas. So Chance, you're going to say a few words about the demographics of our sample.
Yeah, let me talk about that for just a moment. So we had a total of 155 mental health practitioners who participated in our survey, and we gathered a variety of demographic information from them. On average, they were about 43 years old. and almost an even split among the provinces of Alberta and Ontario about who responded to the survey. When it came to gender, it matched fairly well with what the mental health profession already has, is that a majority of them were women, although we had some men and people who responded as an other as well. When it came to race and ethnicity, the majority were white, but we also had some who responded who were East Asian, Black, Indigenous, South Asian, and a mixture of other ethnicities as well. And when it came to religion, they were majority Judeo-Christian, definitely a high percentage of spirituality. Atheist and agnostic were up there as well, above just around 10%. And then there was some mixed religious, spiritual beliefs as well. Then when it came to the occupations that the mental health practitioners had, they varied pretty widely. That we had psychologists, counselors, social workers, marriage and family therapists, graduate students who were becoming counselors. We had addiction counselors. Then we had a group of these other people who were maybe career counselors, helping in other areas, crisis counselors. So all these different occupations. And when it comes to the mental health field, these people with these different occupations will view the presenting problem or what the person is dealing with in just a slightly different lens. And then their education, most of them had master's degrees, while some had bachelor's, doctorates, and then some others who were working in some of these fields that had some college or maybe even just had finished their high school equivalent. So a variety of differences.
So let's take a look at how they answer the question about, to what extent do you think relationship and religion and spirituality issues contributed to your client's mental health and addiction, in the last 30 days? And these were people who answered quite a bit or extremely. So, it's on a scale of 5. So we only took the top 4 and 5 ratings. So about 50% of them thought relationship contributed to their client's problems. But, like their subcategories, parent-child, was higher. Couple relationship was pretty high, family relationship, and less so work relationship. And religion and spirituality, how much do you think, to what extent do you think religion and spirituality issues contributed to your client's mental health and addiction problems during COVID? And they said only 14% said yes. But then they said, they agree that 40% said religion and spirituality contributes to the resilience of these clients. So we asked, how often do you inquire about these 2 areas in your intake assessment? That is the first 2 sessions. So almost 7% of them said, yes, we do ask these questions. They ask parent-child questions, couple relationship questions, family questions, but less so work questions. And in terms of working with these issues, 70% said they try to work on these relationship issues with the clients individually, and only a small percentage, 17%, would ask family members to come in and work with them together. And that could be a problem in terms of getting the full picture. If you hear one side of the picture and if there's conflict, you can't coach them to work with the other side, and you don't hear the other side of the story. So the family therapy literature says working with relationship problems individually is not such a great idea compared to if you could see both parties who are involved in the conflict. So religion and spirituality issues, 40% of them said that they ask these questions about religion and spirituality. So it's under 50%. And it's pretty much equivalent in terms of Alberta and Ontario counselors. No significant difference there. So we ask, do you work with these issues? Whether it's relationship or religion and spirituality, or intend to work. So working, 65% of them said they work with relationship issues. 15% of counselors said they work with religion and spirituality issues. And the intention to work, higher for relationship issues, lower for religion and spirituality issues. But there seems to be some differences, and Samuel, who did this analysis, said it was not significant, the differences between provinces. But if you look at it, like Ontario tend to have higher percentages, slightly higher in working with these issues, Ontario counselors. So we said, do you wish to get more skills in these areas? And the counselors said, 64% said, yes, they want more skills, enhance their skills for relationship issues. Quite a bit, are quite on the higher end, 4 or 5. Religious spirituality issues, 56%. So it's over 50%.
Bonnie, if I could have you just jump back one slide. We missed one, the one about confidence, which is an important piece, because you were talking about did they work with or intend to work with them? And part of that intent, which we imagine they might intend to, but don't do it, in part because they lack the confidence and to actually get in there and start working on some of these issues that can be a little more difficult to address for a variety of reasons, which she had talked about earlier.
Right. Thanks for catching that I skipped one slide here. Confidence for working with relationship issues, 64%, religious spirituality, 53%, and desire to enhance skills. Okay, so that was in the slide that I just used to highlight that, 64% and 56%. But confidence, and I highlighted these rows in red because the need for couple therapy is the fastest growing modality of treatment, just because I think many couples are at risk, in our day and age. A lot of pressure put on them, not enough extended family support, plus, cell phones, pornography, all that. So, couples are struggling actually in our society. So it's the fastest growing treatment modality in mental health. But without that, go ahead.
Yeah, and I was just going to say right there on those two that you've highlighted, Samuel actually ran a chi-square difference test and found that they were significantly different from one another based on those two provinces.
So the two provinces are different in these, the confidence and desire area.
Yeah.
Right. Okay. So you can see confidence in working with couples is only 51%. The other higher with parent-child relationship, like helping parents with parenting, that's higher. And here, 39% of counselors in Alberta feel confident in working with couples compared to 61% in Ontario. And I think that's because Ontario has more marriage and family therapy programs for training marriage and family therapists. And we don't have any, we just started one here. University of Calgary has a program, but it's continuing education. It's not a degree program. So relationship, and this is desire. Okay, so again, there seems to be quite a difference between Ontario counselors and Alberta counselors in terms of the desire for more training in couple and family. So Chance, you want to talk about the latent profile analyses?
Yeah, so here in the latent profile analysis, we wanted to also understand what is it about some of these practitioners that makes them perhaps unique in being able to engage in some of the in relationship work and in religion and spirituality work with their clients. So we ran this analysis, and the way that this came out was we found that their results on those questionnaires, that their answers clustered around these different responses. And so you see we've got 3 different profiles. The blue is our high engagers, then we've got the moderate engagers and low engagers in the yellow. And by engagers, we mean how much do they engage in this process. So engagement, how much did they inquire into, feel confident in talking about and working with relationship issues when they were working with their clients. And we looked at these several different factors. Did it contribute to mental health issues? Their intent to work with the relationships, working with the relationships, and enhance these skills. And so we found that the high engagers, when we looked at them, they were significantly higher than the average. The moderate ones hovered around the average, and then the low engagers, which had the lowest sample size, the smallest group, they were significantly lower on below the average on these ones. And we'll talk a little bit more about their demographic and what this means in just a moment. Now, I want to show you this next slide that has the religion, and it has a similar picture, maybe a little bit more exaggerated differences between the high engagers, moderate, and the low engagers in their willingness and ability to engage with religion and spirituality when it came to working with their clients and their clients' mental health problems. Okay, so let's talk about some of these demographics. So for the moderate and the high engagers, they came from both provinces, but the low engagers tended to come more from Alberta. And these high engagers tended to be older, have more experience and education, tended to be a marriage and family therapist by occupation, and be a part of the Judaic or Christian religions. The moderate engagers, though they had the largest profile, and these tended to be more of the professional practitioners, counselors, psychologists, social workers, to be Christian and focus more on spiritual religions. The low engagers, they were the smallest, as I'd mentioned previously, and they were younger, less experienced, and less education. They were employed in employment counseling, career counseling, crisis counseling areas, and their religious and spiritual views tended to be atheist, agnostic, and maybe spiritual. But a very, very low percent were Christian. And then as they responded to the questions, their inquiry, as that came together, it was more clear that the high engagers saw the importance of relationships or viewed relationships as important. Also, the religion and spirituality of their clients as important, and how the clients viewed how COVID-19 impacted their mental health and their well-being as well. And these high engagers had the greatest capacity and desire to improve their religion and spirituality treatment. So they already had some capacity, but they wanted to increase that and make it better. The moderate engagers had some below average importance on relationships, the religion and spirituality, and COVID-19. So it was less important to them. So they had a somewhat of a slight desire to improve on their capacity to give treatment based on religion and spirituality. And then the low engagers, relationships and religion and spirituality were not as important. And for them, COVID-19 only sometimes impacted the mental health, and they had a much lower desire to improve their capacity to do treatment that involved religion and spirituality. And it was interesting because the 2 major predictors of these different groups of people and these people overall to actually engage with relationships and religion and spirituality when it came to treatment was the amount of education they had and how confident they were in doing that, which these two are interrelated, because the more education you have and then start practicing it, the more confident you'll be. And then there's kind of the circular loop that helps out there.
And maybe just to emphasize, it's clinicians who have more education, who are older, and who have more experience, who are the high engagers. So it's either because they've been in the field longer, they start seeing the importance of these things, or maybe their education raise their awareness, of the importance of these two areas. So in summary, the pandemic exposed relationship issues intertwined with clients' mental health issues. And probably, it's always around, but the pandemic amplified and magnified the underlying relationship issues and how they interact with individual mental health, maybe one way and the other, bidirectionally. Practitioners lack confidence and skills to inquire and treat a client's relationship issues, especially couple issues. So they're not very high in confidence, there's about hovering around the 60%. Competence in working with couples increasingly important during global crises. So that kind of highlights that during global crises like the pandemic, counselors who can work with relationship issues would be really an important skill set for them to have. Practitioners reflect highest confidence with parenting issues and lowest with couple issues. So we talked about that. And couple therapy predicted to be the fastest growing modality in practice. And just to highlight the importance of working on relationship, and now I have to maybe toot my own horn about this randomized controlled trial that I completed, and it took quite a number of years to complete this in the Alberta Health Services. And it was to compare two ways of treatment for people with addiction and mental health problems, mainly gambling and alcohol use, but they're often intertwined with other comorbidities. And the experimental treatment is to see the client with the addiction with their partner, and 43% of the partners actually also have an addiction, and raise their awareness of their family of origin or adverse childhood experience influence in their present functioning. Alberta Health Services has been using this model. You see the client with the addiction, you see the partner, they want to talk to somebody, but you don't see them together. So this is, in a nutshell, the systemic approach, with this couple therapy approach, you work on raising internal awareness, communication, intergenerational impact, and universal spiritual, which means connection, safety, and worth. And the results of the trial found significantly superior outcomes with this couple therapy method in 9 clinical outcomes. Addiction symptoms, mental health, and emotion regulation, couple adjustment, and reducing life stress. So it might be counterintuitive because you think you might want to treat the individual before you see two together. You see one first, then go to two. But in reality, you want to see two together to improve the individuals. And I am developing a hypothesis that has to do with neuroscience about why that is. Because communication relationship is a very high functioning area of the brain. Actually, it involves multiple areas of the brain. And if you improve their relationship, you're reprogramming multiple areas of the brain, from perception, emotion regulation, communication, and reciprocity. So that's very complex, but that's also an advantage of Homo sapiens over other primates. So engagement, learning to work with relationship issues is really important. Engagement with religious spirituality issues. High engagers dealt more with that. And practitioners' own relationship and spirituality issues actually have been found to be related to their sensitivity to clients' religious spirituality issues. And it doesn't mean you have to believe in a God, it's not that kind of thing, but there's a spectrum, but at least ask about it. And sometimes stress and crises will have negative impact on people's religion and spirituality, but it's of an aspect of diversity training. And because it impacts on people's mental health, we should inquire about it to see if it is a positive or negative impact. So education experience increase sensitivity and confidence to work with these complex domains. And I just published a paper on a course that I taught in health sciences on religion and spirituality for undergraduates in addiction counseling and health sciences. And how to teach a course like that. And in that course, I had indigenous spirituality, Hindi, Christian, atheist, agnostic, the whole spectrum. And how do you teach a course like that? And that's why I wanted to publish this article, so that we can bring this aspect of training more into our diversity curriculum. And the other initiative that I started was to found a one-year 4-course graduate level certificate program in couple and family counseling to advance the field of counseling, and we were just in the middle of our first cohort, and maybe in the future we could do a study on that, just to let you know the segmentation, what kind of people come for that training. That's really interesting, and how they respond to it. Okay, so limitations. So this is a purposive self-selected sample. It's not a representative randomized sample. We rely on the self-reported practitioners. We wanted to triangulate practitioners' reports on these issues with clients, but we had we actually included the clients survey, but we had 35 people who answered among clients. I think because of confidentiality issues and practitioners didn't want to involve their clients in that. So these findings may lack generalizability, and certainly you can't generalize to other provinces, and maybe maybe certain limitations even generalizing to the provinces themselves. And it would be interesting to compare post-pandemic responses of counselors to these issues. Whether this is a reflection of pandemic concerns of clients they see, or well, we're in a post-pandemic, maybe we're not even in the post-pandemic age, but at this point, like that, are things any different? Greater depth needed, maybe we could have asked them to elaborate on the answers more, maybe supplemented the study with a few interviews. Okay, so recommendations: increase practitioners' confidence and capacity in working with relationship and religious spirituality issues to meet the needs of future pandemics and social crises. And we would recommend that counseling education curriculum review what they include in their program. And maybe, it's because I'm a marriage family therapist, so I have my own systemic bias, but I think we need to look at things more holistically and see how they interrelate, rather than looking at problems atomistically. To be more effective. Professional development opportunities. And I've been asked now, because of my research, to give a lot of webinars on how to work with relationship issues, how to teach clients to communicate. So the demand is there. And I think marriage and family therapists who are trained in this area, and also the research, not our research, but previous research from marriage and family therapists, are also better trained in dealing with religion and spirituality issues. So certainly, the profession can take more of a lead. And I'm saying that because we submitted the paper to a marriage and family therapy journal, and the reviewer said, how do you make this appealing to our audience? And that is it for today. So I hope there's a few minutes for questions.
Thank you very much. Very interesting talk. Are there any questions from the audience here or online?
Yes.
Okay, thank you so much. It was very interesting presentation, and I've learned a lot. I just have a few questions. Maybe it's around the methodology. We did a very wonderful work in the literature, and you took us down from, a lot of literature issues. But in the methodology, let me just borrow a question I was asked this morning by a reviewer. There's a paper I submitted. I was a corresponding author and the reviewer. It looks like this kind of work where we're talking about multiple kind of professions, and the reviewer asked, how did we ensure that all these people, I mean the participants, were actually who they say they are? Like we had physiotherapists, nurses, and say, how did you identify them? They were actually these people. For instance, in the demographic here, there's a lot of people, even graduate students, that are intending to start practicing, even social workers and all that. How do we ensure that they are actually counselors? That's one. And again, I don't really know much about the academia sector in counseling.
Yes.
Do we have kind of a board that regulates this profession, and like, where are you supposed to be licensed and like known for you to belong to, like, to become a counselor in Canada? So if that's true, then this kind of research might go through the board, or just to be sure that the people responding are who they say they are. That's the first one. The second one, in your limitation, I was expecting to see maybe something about sample size or something like that, because this is a profile analysis, which is a kind of an extension, a kind of, a variant of the traditional cluster analysis, and is a probability-based kind of analysis. And 150, 155 for, I think, you're using kind of a predictors, or like about 7 of them for 150. It might be small for profile analysis, because I'll be wondering about the entropy issues that's going on in the model. And finally, how I was expecting you to say how you determine the best model that fits this data. And I wanted to know if it depends on the software. If the software was constrained to kind of group these people in 3 classes, or if you determine this statistically, maybe using entropy, probability statistics, information criteria, maximum likelihood type of all those indicators. Thank you so much.
And those are great questions. Thank you. So I'll answer the first question and I'll let Chance answer the second one, okay? The first question, we recruited mainly the participants from these professional associations and people in private practice. So it's not, through social media, it's not widely disseminated. So I think that reduces the chance of people taking advantage of, actually, we did offer a draw. Yeah, so it kind of prevented people from taking advantage of, any kind of monetary reward. And we have certain confidence, in the sample, and that the profile analysis were quite consistent, the 3 levels. Yeah, so I like for somebody who's not part of the profession, they would be more random, probably, in the answers. So I think that gave us some degree of confidence, but that is a question, like how do you ensure that,
This has actually come up with another project, especially with Qualtrics.
Yeah.
Where we had a project that the data were violated, there were bots that were actually mining the data entry. And we also had individuals, so depending on how you set up your security,
Yes.
sometimes people were sharing and then allowing, so you can check both the timestamp, and it's a bit late now, but better late than never. Yay. You can check the timestamping and you can check the IP addresses to validate, not if they're counselors or not, but to counter, because I have to be honest, the bot thing caught me completely out of left field.
We had a grad student doing a project who was confronted, and they were giving away a prize, and they advertised the public survey through Facebook.
Yeah.
They had over 200 Facebook responses, like fill out qualified surveys that all had come from one IP address, just trying.
So what does the IP address tell you? What are you looking for?
Well, it gives you the physical location of where the data are entered from.
The computer identity.
Yeah, the computer identity. Now, there is a threat there from, and ethics is not caught up with this yet, but you can. So if you find, for example, that, and it's probably low probability of risk in this case, But if, let's say, 30 of the 155 all came from one IP address, it means they came from one computer.
Right.
Or from Nigeria.
Or from Nigeria, and you can actually check where the IP. So we actually traced some of the IP addresses to Southern California, which were not Lethbridge students, clearly, right?
Can I jump in right here? Yeah, so I worked on a project a couple years ago, and we experienced something very similar to what the gentleman in the blue shirt was saying. We had about 700, yes, you. We had about 700 responses within, I don't know, a couple hours of each other. So we had to go and filter through all that. So that lesson, as I moved into this data and started going through that data, started looking at the IP addresses, because the data from that one, IP addresses were from all over the world, and we were targeting specific cities. So I looked through those to make sure that we were getting IP addresses in these two provinces and not all over the place. Because, yeah, it was a mess before.
And so Chance, you checked the IP addresses on this data set.
Yes, yep.
Oh, great, thanks. And then we should put that in the publication.
Now, I don't, do you want me to jump in and answer the LPA question?
What?
Do you want me to jump in and answer the profile
Yes,
analysis
just the
question?
statistical part of it. I was thinking the sample size, well, that's what we got anyway. I was thinking whether the sample size is small to give us the required stability for a profile analysis.
We should look.
Because
Is it too small?
yeah, that's what I'm thinking. Huge answer anyways. Because I think as the number of the variables that you're using for this is increasing, then you needed more, like a larger set. Because this is a kind of a form of what they call it now. It's a form of cluster analysis, so to say. So, and I asked, you can actually find out if there's some kind of instability if you looked at the entropy, the information criteria, and so on and so forth. And I wanted to know whether you use that to determine these 3 levels, or whether you constrained the software to give you 3 levels.
Yeah. So when we ran the profile analysis, we ran it with 4 different groups. We did 4 different profiles. We did 2 profiles, 3 profiles, 4 profiles, and 5. And we measured. I have a table. Do you want me to just show you the table?
Yes.
Don't worry.
Oh, yeah, I want to see it.
You
Put it
want
up.
to see it?
If you can share, you might not be able to share.
Oh, I can make you my co-host. Oh, no, I can't because I'm not.
I think this is the table.
Oh, yeah, he
Is it
got it.
there?
Okay.
Yes, we can see it. Yeah.
Okay, great. So yeah, I used these fit statistics to help determine which group would be the best, which model fit the data the best. And so as the AIC and BIC, as they decreased, that made the model fit better. Same with the SABIC. And it continued to go up after the profile 3, as did the entropy, which was helpful and good, right? That kept to continue to go up. And then these low Mendel-Rubin tests, they stayed pretty much the same. Now, as we looked at the profiles, though, and we saw that these fit statistics continued to improve slightly as these groups were separated. So we statistically found that we could have had a couple more groups, but theoretically it didn't make a lot of sense when we looked back at the demographic data to pull them apart, and it wouldn't made a lot of sense to separate them because there wasn't a lot of demographic differences between them. So we maintained it at the 3 different profile levels. In one, just for ease of explanation, and also theoretically it would make more sense to have these 3 different levels instead of these other 4, which would have then had very small, some of them became very small profiles. I don't know if I know I have it in here somewhere, but I don't remember exactly how small, but they were making them pretty small with, less than 10 or something like that. So we didn't go with that. So hopefully that answers your question. I
Sure.
know. Yes.
Yeah, but I think if this data was bigger, these statistics you showed me would be clearer. Yeah, it will separate it more clearer than this, but that's okay. Thank you so much.
Yeah, you're welcome. Yeah, great question.
A little bit to the sample frame, like, you've got, what, 48 and 52, I think was the number, which doesn't add up to 155. But what's the total population that you were sampling from the two provinces?
Well, that's 92% of, well, we only eliminated a few, so that represents about 93% of what we sampled. So what would be the whole sample? 155 is 93%. Or are you talking about the?
How many possible participants could you have?
That we don't know.
Then you,
If there is a board, like I said initially, we can know through the registered. If there's a board for the reservation.
so you can't actually, you don't actually have a response rate as a percentage.
No.
So.
Because, then we would have to, I guess we could look for it because we can find out, well, I don't know, but the number of psychologists, registered, the number of social workers, the number of marriage and family.
But that wasn't your recruitment strategy, right? You didn't sample based on those lists.
No.
How did you structure your sampling then?
No, we just sampled.
Like how?
Well, we sent it to, service organization, counseling service organizations, professional associations. We sent it to, I think, 9 biggest cities, in Ontario. And
So you never contacted the individuals directly, it was all done through these umbrella organizations?
yes,
Yeah, it's a kind of self-selection.
Yeah, it's.
self-selected.
Yeah.
Self-selected.
Yeah, and we did it in the 12, so in Alberta, the 12 most populated cities in Alberta and the 14 most populated cities in Ontario. Contacting those agencies and umbrella groups that Bonnie was talking about.
And how many times, how many reminders?
No reminders.
Just a one time?
Yes.
Okay. And then, sorry, just one last question. As a comparativist, Alberta, I get you're here. Ontario, how do you, what's the rationale? Why Ontario, why not Manitoba or
Well,
Florida?
because it's most populated and, has the highest number of training institutions, and it's a bigger problem, the biggest province.
But how does that matter in terms of the demographic variables like that? I don't understand the connection to your research questions.
Well, we wanted to see if, maybe the hypothesis is that Alberta is going to be under-resourced, compared to Ontario, in terms of the training of the counselors. So I just wanted to compare. So we could have just done it with Alberta.
So are you limited to practice in the province where you're educated?
No.
Then it can't matter.
Well, but I guess.
Mathematically, if we're underrepresented and they have the most schools, wouldn't a number of our therapists come from Ontario then?
Actually, I haven't found too many people who come here from Ontario, but
Well,
anyway.
we're recruiting. Alberta is calling, didn't you see the message? No, I'm just wondering methodologically how, because it's sort of a spurious selection variable, right? So that's where the education programs are. I guess they have more people, but that's not the proportion of counselors to population isn't actually an underlying variable in your analyses, is it?
No. So we didn't really have a rationale, but I wanted to see, whether the level of engagement is different, in the two provinces.
But predicted by education experience based on your results.
And they didn't find a significant difference between the two provinces.
In terms of,
Well, those variables we talked
well,
about.
that wasn't totally clear because we had
Yeah, there were
contradicting
some.
results there.
So this is, I think, is an interesting one, and this would be my question about regulation. I don't know what licensing is like in Ontario, but I know it's absent here, right? So the interesting thing about the Alberta group is they had decreased confidence in their activities, but they also reveled in that decreased confidence, right?
Yeah.
They also had significantly decreased desire in improving.
Yeah.
the comments.
It's Alberta way.
Right, so that was, I think,
Did I say that out loud?
maybe serendipitously or whatever, you're onto something here that reinforces the need for licensing and regular upgrade, and I'm not knowing anything about the Ontario context,
Yeah.
maybe they don't have this either.
Yeah.
But I thought that was pretty telling about
Yeah.
Alberta, that they seem to enjoy the fact that they,
Well, you don't know what you don't know.
but they knew they weren't confident, but they did not want to get training
Yeah,
to.
they knew what they didn't want, that's what worked.
And they're sticking to it.
But they need to know the importance of it, so why would we want it?
Well, and do education and experience co-vary, like you would, like, where does experience start to get counted, right? So I can see, because you might start, what you were referring to, you might be a practitioner, even at certificate level, but then go on, get a master's degree,
I
get a
think we found-
doctorate while I'm still practicing.
I think we found 15 years of experience somewhere. Perchance. You know, in terms of those profile analyses.
Yeah, the high gauge
Yeah.
profile was more than 10, I think you said.
10 or 15 is sort of somewhere around there.
But is that synonymous with education?
No, that was 10 years experience.
Right, but they're not mutually exclusive.
No, you could be doing it at the same time,
Right.
you could even be.
Yeah, that's what I mean. Right, so they may be
Yeah.
two indicators that overlap, not two separate indicators.
Yes.
Without seeing the actual model, the coefficients, it's tough to delineate that, because you would have to run them independent, like basically control the two against each other. I'll pull out the result, which is, I think that's an interesting result in and of itself, from a methodological standpoint, given the field, right? Because for
Makes
most
sense.
of us, you cannot practice until you achieve certain levels of education, but if you can run the two in lockstep, that then means, so you may have 15 years of experience that overlap 100% with 15 years of education.
Sure.
So do you think there's another layer of analysis?
I think methodologically, without seeing sort of the data results in terms of those predictions,
Would you be interested in doing it? Well, that.
for a modest fee.
We are too busy, like.
His time is
million
already
of
busy,
things
yeah.
going. We have a million of things.
Small project, you know?
Even right now, we're still working on something on Aries. I just give.
I would be happy to work on it with you. But you
Well,
should take the lead.
And it maybe it's already there, right? It may be simply, it's just depending on how the model itself was run, because what I'm imagining in terms of the model and the outputs may not be what you actually did. But there is a way to split those up, or just to determine whether or not they're actually a homogeneous variable. Right, just to, like, I think from a publication standpoint, because if you're saying these are the two best predictors, if they're really the same thing, you only have one best predictor, which is actually a temporal function. Which then raises the question of how does experience temporally translate into diversification question? Like, is this really just amount of time under tension cognitively for practitioners to incorporate diverse spiritual and worldviews into their practice? You start with what you know, and then you learn what you don't know, and you expand outward, right? There may be implications for practice.
Well, let's have a chat about that. So that could be, I don't know if I have to fit that into the present paper, or could it be a separate paper, but it's not.
As many papers as you want.
This one is okay, as it is.
Yeah, I think.
Like my Mars, it took us so long, it's not a simple study, it's more complicated than I thought.
But it's okay, quite okay. Yeah.
But for Nature's Study Therapy Journal, maybe. we'll
It's
be happy.
tough with that, with the way that the sampling was done. That presents a challenge, like the generalizability question, which you point out, that will be fine, but it's not uncommon for snowball type, like this purpose of self-selecting. But there's a bias in there, right, which again, without knowing the underlying demography of the profession. In those two provinces, you don't have a reference group against which to actually look to this 155. And then say, okay, yeah, these are actually sort of roughly aligned. So all you have is your 155 mean age of, what was it, 43 with a standard deviation of 14, right? Did you collect data on income?
I think we did, actually, we didn't,
And or place of education, like where they actually?
no, not place of education.
No.
Yeah, because that's important. Though curriculum might be the same, but the actual people delivering it in schools matters. Maybe when the people you're teaching in Lethbridge, you're incorporating some of these things, but maybe it's not happening in other people, in other universities that are producing counselors. And you said something about the curriculum. You even said you will say more when you do discussion, when you talk about discussion.
Yeah, there's a lot going on there.
Yeah, there is. There is. And actually, the journal reviewer said, well, it seems like, the main thrust of this is the latent profile analysis. They kind of question whether we needed to do, the descriptives and all that, but I thought that's interesting.
Yeah, another thing I saw, I don't know, is 14% because spiritualism and is it religion? I can't remember. But 14% of the people answering this thing are atheists. And I don't know how we're going to action it. If I'm an atheist and I don't even believe in these things and I'm supposed to counsel people, I'm atheist to counsel. There will be inherently, it's something I don't really believe on, and I wouldn't believe it should help somebody. And I might even believe people that believe on them are stupid.
We have our own biases.
Yes,
Yeah.
and again, big live data sets in Canada, big census, and even CLSA or some other data sets are showing about 19 to 20% irreligious. People say they are irreligious. They don't believe in these things.
Yeah.
So how do you action it?
Yeah, so that's why people need training, because, that is not just about people believing in God, there's such a diversity of religious orientations. It could be.
But this category would be beyond non-religious. There simply is no religion category. There would never be religious content or context because there is no such thing as religion. Right, so we are seeing that.
So which data set are you talking about?
I read because I was doing an analysis that have to do with religion.
Oh.
So I read some literature. I think up to 19% of the recent census, people are saying they are irreligious, they don't have any concern. In your data set now, up 14% were atheists, but that one is not just atheists, they are like irreligious.
Yeah.
Then I did a qualitative kind of follow-up, and a lot of people I met are over 15%. Like there's a retired chief judge I met, he was like, religion is the most destructive concept human being invented in this universe. So how do you answer that?
So one of the reviewers.
He's the receiver of care, or if he's the giver of care, it's no for me.
Yeah, well, one of the reviewers did say, we need to be more nuanced about religion. Here, at first we kind of posed it as positive, and actually that's what the literature says, it's predominantly positive. But there are meta-analyses that are more revocable. It's not, it's small significance, you can group all the studies together, and it's also cross-sectional, so we need to do longitudinal studies, to show that religion really does make a difference on our spirituality. So, so that's why we had to revise different parts of the manuscript. Yeah.
Just as a demographic question, do you have geographic location, even like regionally within the provinces for your respondents? Because there are some, Chad's shaking his head. So for example, in Southern Alberta, we do have a sort of different religious profile, not just the Latter-day Saints, but different perspectives on Christianity, Christian fundamentalism, but also diversity in now. And if you only sampled the most populous 12, that gets you down to like 30,000 people, like you're talking mid-sized rural exurban service area, right? So you're gonna see geospatial differentiation as well. In Ontario, it will also vary, but maybe not as linear a fashion as we have here in Alberta. That's just something context to keep in mind.
Yeah. Okay. So that's a study in itself, to look at the distribution of religious.
So if you have the IP addresses, you could actually check
Oh,
them.
that's right. Good point.
You could map it and to see.
Is it easy to do?
Yeah,
It's mappable.
yeah, it's mappable.
It's
With a bit of
doable.
that work. Because that could really skew the Albertan data. Like if your respondents were predominantly in Calgary South, you are going to, or if let's say they're all East Central east of Edmonton, which is traditionally Ukrainian, like Vegreville probably didn't hit your list. But you would see that Ukrainian Orthodox over like 89%, right? So going to see these demographic clusters that are geospatially by the settlement patterns of the province, which may then hypothetically, again, not knowing what the full sampling frame is, they have a role there. At least it's an underlying point of interest. Maybe not for marriage counselors, but for demographers alike.
Well, maybe if it's not too hard to find, we'll find, I can tell you.
Yeah, it may show a little bit of a skew, right?
Mm-hmm. That's a
And
really good
again-
point.
And 45% of the sample are Judeo-Christian. I think that's what.
And that would track, but even then there's a, like, where does Greek or Ukrainian Orthodox fit within that, for example, right?
Were the fields for religion like provided by the survey, or was it an open question where
It's
people?
provided by the survey. Otherwise, it's too much work to.
Get more than 16,
Yeah, there you go.
16 to 20 category or more. To be endless.
But because if you have the IPs, you can get the census subdivision data and you can compare it back, because they actually have the specific religious profiles at the census subdivision scale. This is more work than you want to do, trust me. Especially
For
for,
that small.
yeah, for that small
sample.
sample.
Yeah.
But you can at least then know, but I mean, realistically, you say, okay, we've got these 12 and 14, because the biggest one's it's gonna be Toronto, be Ottawa, it's gonna be Burlington, it's gonna be Etobicoke and surround, it's gonna be London and Sarnia.
Thought it was 9, or at least I told my RA to narrow it down to 9. So anyway, we'll take a closer look at that, yeah.
So, but the Toronto stuff is gonna cluster geographically, but the Ontario stuff is gonna be much more clustered. It's basically gonna be the Hull, Ottawa, and down the St. Lawrence Seaway pathway. Alberta might be interesting just to check.
The population was probably so self-selected. Did I see that it was like 80% self-identified as white? Were those categories provided by the survey as well as? Okay. So, I mean, not that there is a perfect relation by any stretch, but, say you had like 5% of East Asian population or something like that, so.
Actually, maybe we didn't highlight that, but among the high engagers is the East Asians and the indigenous people who are in the high engagers category for religion and spirituality. East Asians and indigenous. But in terms of ethnicity,
More so in
ethnicity,
Ontario than Alberta?
well, I don't know if we broke it down.
What was that when I was looking something up?
Oh, the high engagers. For religion and spirituality, I think we said is East Asians and indigenous.
Were a very, very minor proportion of.
Yep, I believe that's true.
Less than a dozen altogether.
Yeah. Small group,
Less than 2%.
maybe they all are up there in that category. I don't know.
Well, and were you able to, just coming back to the descriptives, to get a sense of what the spiritual profiles were across those ethnic categories, like you presented them independently, but you could.
We didn't, well, maybe that could easily be done.
Yeah.
Yeah, we haven't done that yet.
Because and again, the distribution of the subpopulations within the sample is problematic because they are so small. But often there's this, so if sometimes we have assumptions about populations that are like, oh, well, there would be animist or, it turns out that these participants are all Roman Catholic, right? They're Judeo-Christian, just depending on where they are regionally. So there may just be a little bit of nuance or granularity there that can be teased out really quickly. If only to then you can say, yeah, it turns out, in this group, white people are Judeo-Christian and.
Across gender lines as well.
We have predominantly women.
Yeah.
But in terms of the high engagers.
High engagers, yeah.
Women may be higher engagers.
Sorry.
Female may be higher engagers.
That was great. Thank you.
Thank you so much again. Thank you very much.
Thank you. That was funny.
Yes.
Give me your card or contact.
Thank you for your time.
Thank you so much,
Yes.
Dr. Bell. And
Thank you.
Thank you, Chance. Let's talk
Yep.
after.
Yep. Thank you.